Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM Institutes. The instructions I normally give you, I thought that I should present you these instructions. This is our online group, basically, the class we take for the students who join Dr. BKM Institute. So I've just taken the click shots of these things of Dr. BKM online group, but I wanted to tell you some important instructions. That's why I took this click. So basically it says that please note these things, that you will get 3-minute preparation time, 5 minutes for one role play each. There would be 2 role plays. So overall speaking would be of 20 minutes. First warm-up questions will be there. These warm-up questions do not have any marks. You can skip any point. There is no deduction of marks. There is no deduction of marks अगर आपका कोई point रह जाता है. Overall, I would like to repeat is very important. Summarize करना बहुत जरूरी है. तो summarize के marks हैं पक्का. आप skip कर सकते हो एक point जो आपको समझ नहीं आ रहा या आपके पास टाइम कम है, लेकिन summarize जरूर करो अपने टास्क को. Overall, I would like to repeat that. ऐसे करके बोलो. Overall, I would like to repeat that there is nothing to worry. जो भी आपका टास्क था. Examiner does not have any marks. He is just a patient. Whether he is reluctant or aggressive, कुछ भी हो सकता है. But he is just a patient. You always behave like a nurse. Don't panic. He does not have any marks. I would like to repeat that he does not have any marks. So please do not panic. Second point. Apart from this, let's go to the other points. Today's speaking role play, but I will go to the role play first, then I will take you this. So today's role play is that this 30-year-old patient is concerned that her child's forearm, which appears broken. The parent wants to know about the treatment and if the fracture will affect future growth. So basically fracture हो गया, child की forearm है. Find out how it happened. तो as a nurse आपको पूछना है ये हुआ कैसे. तो please इसमें आप grammar गलत करते हो. तो how did it happen? Please समझो, how did it happen? Examination shows that child has suffered a greenstick fracture which will require a plaster cast. अब अगर ये टॉपिक पेपर में आएगा तो ये टॉपिक बहुत ही छोटा है, आप इसके बारे में 5 मिनट्स बोल ही नहीं सकते. लेकिन अगर पेपर में आएगा तो आपको ऐसी बातें दी होंगी. कैसी बातें? कि ग्रीन स्टिक फ्रैक्चर क्या होता है, ये चाइल्डहुड में फ्रैक्चर हो जाते हैं क्योंकि बोन सॉफ्ट होती है, बोन बेंड करती है और ब्रेक डाउन हो जाती है. तो ये सब आपको दिया होगा पेपर में. तभी आपको मैंने जब आज ऑनलाइन ग्रुप में एडिशनल पॉइंट भेजा कि पेपर में अगर आएगा तो आपको ये सब कुछ दिया होगा. विच विल रिक्वायर अ प्लास्टर कास्ट एंड स्लिंग. फ्यूचर ग्रोथ शुड नॉट बी इम्पेयर्ड. उसको ये बताना है. वैसे तो शुड की जगह यहाँ पे होना चाहिए था वुड. तो फ्यूचर ग्रोथ विल नॉट बी इम्पेयर्ड, कि फ्रैक्चर से कोई नुकसान नहीं होगा. गा विल. Approximately 6 weeks to heal. All the normal activities okay with limitations of wearing plaster. तो प्लास्टर पहनना पड़ेगा लेकिन बाकी सब कुछ ओके रहेगा. लेकिन पेपर में आएगा तो आपको ये सब दिया होगा. ग्रीन स्टिक फ्रैक्चर, ट्रीटमेंट में पेन किलर्स लेनी है, प्लास्टर कास्ट और स्लिंग, हीलिंग 6 वीक में अप्रोक्सीमेटली होगी. पोस्ट ट्रीटमेंट फर्स्ट 4 weeks नो मूवमेंट, देन ग्रेजुअल मूवमेंट आफ्टर रिमूविंग प्लास्टर. After 6 to 8 weeks, all the activities can be resumed when the fracture heals completely. Reassure father that there is nothing to worry. Common in kids, healing fast because kids are in the growth phase. So that is how you have to speak the topic. अब मैं आपको बोल के दिखाऊंगा, तो आप प्लीज सुनना. Good morning, my name is Bhupesh. I am a charge nurse here. Sorry, दोबारा शुरू करते हैं. Good morning, my name is. और तभी मैं कहता हूँ यार, मेरे को भी लिखना चाहिए. देखा मेरे जैसे इतना आई हैव बीन टीचिंग सिंस लास्ट 9, फिर भी गलती हो जाती है. तभी मैं कहता हूँ हमेशा लिखो, क्योंकि आप कंफ्यूज हो गए पेपर में. जैसे अभी मेरा ध्यान जरा सा हटा और मेरा गड़बड़ हो गया, तो इसलिए प्लीज इस चीज से आपने सीखना है. वैसे मैंने जान के गड़बड़ किया ताकि आपको ये बता सकूं, और रिकॉर्डिंग भी हो रही है, मैं शायद इसलिए भी कह रहा हूँ. तो ये आप जज करते रहना जो रिकॉर्डिंग हमारी सुन रहे हैं. लेकिन मेन बात यही है कि मैं आपको ये बताना चाहता हूँ कि लिखना है हाउ मे हेल्प यू. कि पेरेंट अगर क्लिनिक में आया तो आपको बताना है माय नेम इज हियर, आई एम अ नर्स हियर. बस पहले ही लिख दो, ये लिख दो. चाहे आप डेली बोलते हो, गलती हो जाएगी पेपर में. पेपर में गलती की स्कोप नहीं है, तो लिख दो. अब देखना मेरे से बिल्कुल गलती नहीं होगी. अब मैं आपको बोल के दिखाता हूँ. गुड मॉर्निंग, माय नेम इज भूपेश, आई एम अ नर्स हियर. सो कुड यू प्लीज टेल मी हाउ मे आई हेल्प यू. वेल नर्स, प्लीज हेल्प माय चाइल्ड, माय डॉटर. शी इज हैविंग forearm pain and it's swollen. Please help her, nurse. Please calm down. Don't worry. Let me examine your daughter first. Okay. After examination, I have found that your daughter has got fracture and she needs to have a plaster cast and a sling. Oh my God, nurse, like, oh my God. Well, first of all, I would like to ask you, how did it happen? Well, nurse, it just happened by itself. She went to a kindergarten and there she slipped and then they told me that her arm is swollen and she's saying she's having lot of pain. So I have come here. Okay, don't worry. So as I have already examined your child and I have told you that she requires a plaster and a sling. So we will put this plaster and sling to your daughter's arm, and then she will start feeling better. And this plaster and sling is very important to immobilize the arm. Your daughter is having green stick fractures. So do you know what are green stick fractures? No, nurse, I know nothing. Okay, so let me explain you every point one by one. First of all, the green stick fractures happen in childhood when the bones are soft, and children are quite vulnerable and prone to it because children have got bone development. There is a growth phase, so the bones are not very hard. So they are vulnerable to fractures, and that is what has happened with your daughter. So she has got the fracture, but there is nothing to worry because they are in the growth phase. So the speed of healing is very fast. So please don't worry, your daughter would be fine. But nurse, she won't be able to move her arm. There would be so many things if we will put the plaster. Don't worry, let me explain you all things one by one. First of all, painkillers will be prescribed by the doctor for the pain. So your daughter will not feel any pain. So let me give one of the painkillers right now to your daughter. May I? Yes, nurse, please. Okay, so I have given the painkillers. Now your daughter will feel less pain, and also doctor will prescribe you certain painkillers. So keep following all the instructions. Apart from this, plaster, cast and sling would be applied to immobilize, and the healing would take approximately 6 weeks. Post treatment, first 4 weeks there would be no movement, so please do not try to move the arm at all. Just let it be stationary as the doctor will tell you. Then you can start doing gradual movement. Tell your daughter to have gradual movement slowly, and then after the removal of the plaster, she would be able to resume her activities in 6 to 8 weeks, and all the activities like she used to do priorly, the same activities she can resume afterwards. Is there any question that you would like to ask? Anything that is troubling you? Well, no, nurse, these are the things and I am pretty okay, but it's just about my daughter. Would she be fine? Would all the activities be fine? Like I have already told you, all the activities can be resumed when the fracture heals. And also, I would like to reassure you that there is nothing to worry. It is quite common in kids, and healing will be very fast because kids are in the growth phase. So you don't have to worry about anything, and your daughter will be fine within like 1.5 months or 2 months. Is that okay? Well, yes, nurse. And please don't be upset because kids are quite vulnerable to these kind of fractures because they play, they are learning lot of things. So there is nothing to panic. It is quite a common incident that happen among among kids. So please do not worry. Okay, nurse, but I just got scared. Well, that is obvious. Being a parent, I can understand that it is not easy to see your daughter in such kind of a problem, but that is part of life, and she would be fine as we will apply the plaster and sling. So would you please allow me to apply the plaster and sling now? Well, yes, nurse. Okay, then take care, and I am applying the plaster now. Done. आप अपने रोल प्ले को ऐसी जगह पे भी खत्म कर सकते हो कि अब मैं प्लास्टर अप्लाई कर रही हूँ. So that is how it can be done. So now I will take your questions. If you will have any questions, you can ask me about this role play, and please write your first line. मैं आपको बार बार कह रहा हूँ, ये मैंने आपको करके भी दिखाया कि फर्स्ट लाइन गलत हो सकती है, तो इसलिए पहले ही लिख दो. डोंट बी ओवर कॉन्फिडेंट. डोंट थिंक कि मेरे को तो आता ही है, मैं तो रोज ही बोलती हूँ. फर्स्ट लाइन इज वेरी इंपॉर्टेंट. It takes your whole momentum away if you do not do it right. So please, first line. Please like, subscribe, and hit the bell icons for the free OET coaching videos.